You know, pain is something every single one of us understands. It's that universal signal from our body that something's wrong. But what happens when that signal is just screaming at you? Or worse, what if it never, ever turns off? Well, modern medicine is right in the middle of this quiet revolution in how we treat pain, especially in the hospital. We're moving way beyond just pills to something much smarter, much more targeted. So let's dive into how that works. First, I want you to just look at this number. $500 billion. Let that sink in for a second. It's one of those figures that's so massive it almost doesn't feel real. But what on earth does it represent?
That right there is the annual cost of pain just in the US. Think about that. It's more than we spend fighting heart disease, cancer, or diabetes. But honestly, the financial cost isn't even the real story. The real cost is measured in sleepless nights, missed family moments, a life that's just smaller than it should be. So what exactly is this thing we call pain?
Well, here's the official take on it. The key words there are sensory and emotional experience, and that is absolutely crucial. See, pain isn't just a physical zap in your arm, it's also how your brain processes and reacts to that signal. It's all tangled up with our emotions. And that complexity, well, that's exactly why treating it is such a massive challenge. So let's start with just how staggering this problem really is. For a long, long time, the medical world kind of struggled with pain. It was often seen as just a side effect, a symptom you just had to grit your teeth and bear, not something to be treated aggressively on its own. Next up, we have to talk about the opioid dilemma. Because in the search for a better way to treat all that pain, a whole new crisis was born. It's a classic story of how trying to solve one problem with the best intentions actually paved the way for something far worse. So how did we get here? Well, back in the 90s, there was this big, important push to stop undertreating pain. And by the year 2000, that led to pain being called the fifth vital sign, putting it on the same level as your blood pressure or your heart rate. And that simple change led to a massive spike in opioid prescriptions. The goal was noble, but the result, well, it was the devastating opioid epidemic we're all too familiar with now. And this, right here, is the crucial turning point. The absolute tragedy of the opioid crisis forced everyone to go back to the drawing board. The new mission wasn't just to treat pain anymore. It was to treat pain while using as few opioids as humanly possible. And that created this incredible, urgent demand for real innovation. So what did that innovation end up looking like? Well, the answer is a whole new strategy that goes way beyond just writing a prescription. It's called multimodal analgesia, and it's a complete shift in how we approach pain relief. Okay, so what is it? Simply put, multimodal analgesia is about fighting pain on multiple fronts at the same time. Instead of relying on one big, powerful drug like an opioid, doctors use a cocktail of different medications and techniques. Think of it like a coordinated attack. You're hitting the pain signals from all different angles, which gives you way better relief with fewer side effects. Now, here's a really tricky part of pain management, especially after a big surgery or injury. What happens when those pain signals just get stuck? Like the on switch is jammed and the alarm just won't shut off. This is what scientists call central sensitization. Basically, the whole nervous system gets wound up and becomes hypersensitive. That home security system analogy is perfect. Imagine your alarm is now so sensitive that it goes off when a leaf blows by the window. That's your nervous system amplifying every little signal into a huge threat. This is how acute pain turns into chronic pain. And that's why these early multimodal treatments are so critical, to stop that system from ever getting stuck in the first place. Okay, so let's look at the cool new tools that doctors are actually using to make all this happen. We're talking about bedside interventions that are completely changing the game. There are basically three main types of these blocks. First, you've got neuraxial blockade. Think of an epidural. It gives you fantastic, predictable pain relief, but it can have some side effects like weakness. Then there are peripheral nerve blocks, which are like sniper rifles for pain, super targeted, numbing just one specific arm or leg. And finally, fascial plane blocks, which are a newer technique to cover big areas of the body with fewer pokes. So how does a doctor choose? Well, it's really a strategic choice between broad relief and targeted precision. If you've just had major abdominal surgery, you need that big, powerful, widespread relief. That's a job for a neuroaxial block. But for something like a broken arm, a super precise peripheral nerve block is the perfect tool for the job. Now, the technology that makes all of this possible, the real hero of the story, is ultrasound. It's a total game changer.
It lets doctors literally see the nerves and tissues in real time as they guide the needle. This has made these procedures unbelievably safer and more successful than they've ever been before. So we've seen all these amazing tools, but that's only half the battle, right? How do doctors figure out which tool to use or where the problem even is? It all comes down to their systematic approach to something that is deeply, deeply subjective. I mean, think about it from your perspective. This is the big question, isn't it? You're the one feeling it. How can someone else possibly know exactly what your pain feels like, where it's coming from, and how to make it stop? Well, it all starts with something surprisingly old school. They listen. A really detailed history is the foundation of everything. Doctors ask incredibly specific questions. When did it start? Where exactly is it? What does it feel like? Is it sharp? Is it dull? Is it a burning feeling? And maybe most importantly, what makes it better and what makes it worse? Your answers are the clues that guide their entire plan. Next, they have to try and measure it. You've all seen these, right? The little smiley faces or the numbers from 1 to 10. The whole goal here is to take something subjective, your personal feeling of pain, and turn it into an objective number. That 7 out of 10 gives the whole medical team a common language to track how you're doing and see if the treatments are actually working. But what about patients who can't just tell you a number? For someone with advanced dementia, for example, this is where the approach gets really thoughtful. There are special tools like this pain ad scale, where clinicians assess pain by observing things like a person's breathing, their body language, or their facial expressions. It's a powerful way to make sure that everyone's pain gets seen and gets treated. So, let's tie all of this together. The future of relief. Why does all of this really matter? Because this shift isn't just about fancy new techniques. It's about fundamentally changing people's lives and their experience in the hospital. The impact, honestly, is huge. When this is done right, it dramatically improves how satisfied patients are with their care. It can actually shorten how long you have to stay in the hospital. It massively cuts down on the need for opioids. It gives better, more targeted relief, and maybe the biggest deal of all, it helps stop that short-term, acute pain from turning into a lifelong chronic problem. And that leaves us with this incredible final thought. We've gone from seeing pain as something you just have to suffer through to seeing it as a vital sign to be managed. But as our understanding keeps getting better, what if we're on the verge of the next great leap? What if we could stop that hypersensitive alarm system before it ever gets stuck in the on position and actually prevent chronic pain before it even begins? Now that is the true frontier of relief.